Xultophy 100-3.6 Insulin Pen is a combination of insulin degludec and liraglutide. It is used with a proper diet and exercise program to control high blood sugar in people with type 2 diabetes. Controlling high blood sugar helps prevent kidney damage, blindness, nerve problems, loss of limbs, and sexual function problems. Proper control of diabetes may also lessen your risk of a heart attack or stroke. Insulin degludec is a man-made product that is similar to human insulin and acts longer than regular insulin, providing a low, steady level of insulin. It works by helping blood sugar, glucose, get into cells so your body can use it for energy. Liraglutide is similar to a natural hormone in your body, incretin, and works by causing insulin release in response to high sugar levels, such as after a meal, and decreasing the amount of sugar your liver makes. The daily dosage of Xultophy 100-3.6 Insulin Pen should be determined by your healthcare provider, and the best time to take it would be as directed by your doctor. Make sure to read the medication guide and instructions for use provided by your pharmacist before using the Xultophy 100-3.6 Insulin Pen, and every time you get a refill. It's important to learn all preparation and usage instructions, and if you have any questions, don't hesitate to ask your doctor or pharmacist. Before using the pen, check it visually for any particles or discoloration. If you see either of these, do not use the liquid. Also, before injecting each dose, make sure to clean the injection site with rubbing alcohol. It's important to change where you inject each time to reduce the risk of problems under the skin. You should not inject into skin that is red, swollen, itchy, or damaged. The Xultophy 100-3.6 Insulin Pen should be injected under the skin in the thigh, abdomen, or upper arm as directed by your doctor, usually once daily. It's important to use a new needle for each injection. This medication may be used with or without food. Make sure not to inject into a vein or muscle because it could cause very low blood sugar. The dosage of Xultophy 100-3.6 Insulin Pen is based on your medical condition and response to treatment. Your doctor will start you on a low dose first to decrease your risk of stomach/abdominal side effects, and gradually increase your dose. If more than 3 days have passed since your last dose, ask your doctor if you should restart with the low dose to reduce your chance of side effects. It's very important to follow your doctor's instructions carefully. It's crucial not to share your pen device with another person, even if the needle is changed. This can result in a serious infection. Make sure to learn how to store and discard medical supplies safely. Use this medication regularly at the same time each day to get the most benefit from it. If your condition does not improve or gets worse, make sure to inform your doctor, especially if your blood sugar is too high or too low. Some common side effects of Xultophy 100-3.6 Insulin Pen include nausea, vomiting, stomach upset, decreased appetite, diarrhea, constipation, stuffy/runny nose, weight gain, or pain/redness/irritation at the injection site. Nausea usually lessens over time, but if any of these effects persist or worsen, it's important to contact your doctor or pharmacist. Remember, this medication has been prescribed to you because the benefit to you is greater than the risk of side effects. Many people using this medication do not experience serious side effects. However, vomiting or diarrhea that doesn't stop can lead to dehydration, so it's important to contact your doctor if you notice any symptoms of dehydration, such as dry mouth, fast heartbeat, or dizziness. Be sure to tell your doctor if you experience any serious side effects, including signs of low potassium level in the blood, signs of kidney problems, or mental/mood changes. Also, contact medical help right away if you experience signs of pancreas or gallbladder disease. It's important to be aware that this medication can cause low blood sugar, which may occur if you don't consume enough calories from food or if you do unusually heavy exercise. Symptoms of low blood sugar include sweating, shaking, fast heartbeat, hunger, blurred vision, dizziness, or tingling hands/feet. To help prevent low blood sugar, eat meals on a regular schedule and do not skip meals. If you miss a meal, check with your doctor or pharmacist to find out what you should do. If you experience symptoms of high blood sugar, such as increased thirst or urination, be sure to tell your doctor right away. And if you notice any symptoms of a serious allergic reaction, such as rash, itching/swelling, severe dizziness, or trouble breathing, seek medical help immediately. This is not a complete list of possible side effects, so if you notice any other effects, be sure to contact your doctor or pharmacist. This medication may lead to the development of thyroid C-cell tumors in rats and mice. Whether this medication can cause similar tumors in humans is currently unknown. It is important to discuss with your doctor about the benefits and risks of using this medication. Do not use this medication if you have a certain inherited disease, men too, or if you have a personal or family history of medullary thyroid carcinoma. If you notice any signs or symptoms of thyroid tumors, such as unusual growth or lump in the neck, difficulty swallowing, shortness of breath, or unusual/lasting hoarseness, it is important to inform your doctor immediately. Before using the Xultophy 100-3.6 Insulin Pen, it's important to tell your doctor or pharmacist if you are allergic to insulin degludec or Liraglutide, or if you have any other allergies. This is because the product may contain inactive ingredients that can cause allergic reactions or other problems. It's also important not to use this medication when you have low blood sugar, hypoglycemia. Before using the medication, be sure to inform your doctor or pharmacist about your medical history, especially if you have kidney disease, liver disease, pancreatitis, gallbladder disease, stomach or intestinal disorders, or mental/mood disorders such as depression or thoughts of suicide. You may experience blurred vision, dizziness, or drowsiness due to extremely low or high blood sugar when using this medication. Therefore, it's important to avoid driving, using machinery, or doing any activity that requires alertness or clear vision until you are sure you can perform such activities safely. It's also recommended to limit alcohol while using this medication, as it can increase your risk of developing low blood sugar. Additionally, it may be harder to control your blood sugar when your body is stressed due to fever, infection, injury, or surgery. In these cases, it's important to consult your doctor, as it may require a change in your treatment plan, medications, or blood sugar testing. Before having surgery, it's important to inform your doctor or dentist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. It's also recommended to check your blood sugar before and after exercise, as you may need a snack beforehand. Older adults may be more sensitive to the side effects of this drug, especially low blood sugar. During pregnancy, this medication should only be used when clearly needed, and it's important to discuss the risks and benefits with your doctor. Pregnancy may cause or worsen diabetes, so it's important to discuss a plan with your doctor for managing your blood sugar while pregnant. Your doctor may change your diabetes treatment during your pregnancy, including diet and medications such as insulin. Lastly, insulin degludec passes into breast milk, and it is unknown if liraglutide passes into breast milk. Therefore, it's important to consult your doctor before breastfeeding while using this medication. Drug interactions have the potential to change how your medications work or increase your risk for serious side effects. It's important to keep a list of all the products you use and share it with your doctor and pharmacist. This includes prescription/non-prescription drugs and herbal products. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Beta-blocker medications may prevent the fast or pounding heartbeat you would usually feel when your blood sugar falls too low. It's important to note that other symptoms of low blood sugar, such as dizziness, hunger, or sweating, are not affected by these drugs. There are many drugs that can affect your blood sugar levels, making it more difficult to control. Before starting, stopping, or changing any medication, it's important to talk with your doctor or pharmacist about how the medication may affect your blood sugar. Regularly check your blood sugar levels as directed by your doctor and inform them about any symptoms of high or low blood sugar. Your doctor may need to adjust your diabetes medication, exercise program, or diet based on these results. If you suspect someone has taken too much Xultophy 100-3.6 Insulin Pen and they have severe symptoms like passing out or difficulty breathing, call 911. Otherwise, contact a poison control center immediately. In the US, you can call 1-800-222-1222, and in Canada, you can call your provincial poison control center. Symptoms of an overdose may include shakiness, rapid heartbeat, excessive sweating, and loss of consciousness. It's important not to share this medication with others. If you're taking Xultophy 100-3.6 Insulin Pen, it's a good idea to attend a diabetes education program. This will help you learn more about managing your diabetes with medications, diet, exercise, and regular medical exams. Make sure to learn the symptoms of high and low blood sugar, and how to treat low blood sugar. It's also important to check your blood sugar regularly as directed, and share the results with your doctor. While using this medication, you may need to have lab and/or medical tests done, such as liver/kidney function, fasting blood glucose, and hemoglobin A1c. It's important to keep all medical and lab appointments. If you forget to take a dose, just wait until your next regular dose. Don't take extra to make up for the missed dose. When using Xultophy 100-3.6 Insulin Pen for the first time, you should keep it in the refrigerator, but make sure not to freeze it. If the product has been frozen, do not use it. If the unopened product is kept at room temperature, it must be thrown away after 21 days. After the first use, you can store the medication at room temperature or in the refrigerator. Remember to protect it from heat and light, and keep it in the original carton. Don't store it in the bathroom, and throw it away 21 days after first use, even if there is still some medication left in the pen. Keep all medications away from children and pets. When it comes to discarding the product, do not flush it down the toilet or pour it into a drain unless instructed to do so. Make sure to properly discard the product when it is expired or no longer needed, and consult your pharmacist or local waste disposal company for the correct way to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.